Second.
Don't be sorry.
Well, it's now 8 o'clock, so it would be nice if. There we go. Now we're live. Oh, we've been live for 6 seconds.
Oh,
Okay. Now we're talking. Let me just make. There we go. Okay. Oh, here's our assistant. Here is the Nurse Jake. Paging Nurse Jake. I'm getting you in the. There you go. I don't know what's going on over there.
what was going on
He's
there?
facing the piano, and he's gone.
Bye, buddy.
Okay. Hey everybody out there, as people are coming in the Facebook room here. I've got Dr. Paul Bean right here on the couch. It's always good to be on a couch. That looks very comfortable.
My feet are up.
Do you ever worry about a white leather couch with your? I mean, I guess your kids are not as crazy as mine.
So you're obviously not looking closely. There's pen marks,
Yeah, I can't
dog
see from
fur.
here.
Yeah, pen marks, dog fur, mastacholi stains.
Oh, that's very specific. Moss and Choli stains. That's fair. Well, all right, then that's good to know that my suspicions. We were talking about furniture, and I just don't think in this house we can't go white quite
This is from
yet.
a store no longer. Kittles. Do you remember
Oh
Kittles?
yeah, Kittles of blessed memory. I do. That's where we bought some bedroom furniture, I believe.
That was fair.
Yeah, yeah, that's exactly. That's why it's no longer around.
Correct.
It was fair. Hey there, I see Miriam is watching. Hi, everybody. My Facebook has been doing this weird thing where I can't see comments when they pop up, but hopefully they'll pop up at some point. But why don't I? Oh, I'll let you take care of that. Yeah,
Oh, no,
you got stuff over
uh,
there, and then I'll introduce the doctor of doctors. Or we can just do it now, because
no, yeah,
yeah.
ready.
We got 9 people who are watching already. Oh my goodness.
Probably 8 of which are my family members.
And my family members combined together. We know we have at least a couple other people. Oh, we're up to 10. All right. Well, hi, everybody. I am here this evening with none other than your favorite ER doctor and mine, Dr. Paul Bean. Round of applause. Round of applause. Round of applause. Before we even get started, if you have questions for the good doctor, we're talking COVID stuff, but I guess if you have other questions, that's fair. He's not looking to check any rashes or anything, but if you have questions about what's going on in the healthcare world these days, you can stick them in the comments here, and I will read them to Paul, and hopefully that'll elicit some responses, and that'll be great. So, Dr. Bean, welcome.
Thanks, Benji.
Nice to see you. So, how's your life? First of all, before we talk medicine, how's everything going with your crazy work-life balance?
Yeah, fine. It turns out that I'm a better emergency room physician than I am third and fourth grade teacher.
That's shocking. As I'm feeling the same thing. I'm a better emergency room physician than I am a homeschool teacher.
I thought you were going to say you were a better emergency room physician than you are a rabbi.
No, well, that is also true. Much better.
Not true.
You need a stitch? I'll take care of it for you.
Oh, Rabbi Benji.
Yeah, that's right. Yeah, that's fair. We've been in New Albany. We've been all virtual for the last. It's only day 3, but it seems like it's week
Only
10.
day 3. It feels like an eternity.
It does. It is those teachers. What I've learned from this experience when they're kind of on with their teachers most of the day is those teachers who I knew had patience. But man, I listen to them like deal with these kids and their muting situation and their distraction, and I think it takes a special kind of person to be able to do that. So,
One kid was in bed this morning. The teacher said, you should probably go down to the kitchen table and get out of your pajamas.
that's hysterical.
Yeah, it's so as you know, I'm on the district task force, so it's been interesting to kind of see what goes into decision making to pull from like a hybrid to a virtual. Um,
Yeah.
I don't envy the superintendent nor the school board. They're doing the best that they can be doing.
Yeah, I have as a parent felt really good about the safety measures that they take. Especially, I mean, we have younger kids and it's slightly younger than your kids, but about the same age, and I have felt really good about it so far. Hopefully, after winter break, we can maybe be hybrid and maybe all. We'll see what
I hope
happens.
I'll start with some hybrid, and this is just what I hope for. Certainly, I don't
Yeah.
have any good information at this point, but you know, hopefully start with some hybrid and then see how everyone's looking. Worried about people traveling and letting their guard down a little bit over the holiday. And trust me, I could sit on a beach, but I just hope people when they travel are safe.
Yeah.
They practice safe practices, social distancing, hand washing, quarantining if necessary.
Yep. Yeah. Yeah. I guess there. I mean, there are ways to travel safely, but it takes a lot of discipline, I think, to do it that way.
Yeah, and it's not, I think, what we're accustomed to, and it's not ideal, and it might feel less like
Yeah.
vacation, but
Yeah.
it's still better than the cold weather and the snow that we got today, right?
That is for sure. Yeah. I'm looking at it. I'm looking out at a few inches on the top of our bushes outside here, and
Did you shovel yet?
I did not. I just decided to drag my garbage cans through a layer of snow instead.
I
So.
did the same thing.
Yep. So for those who don't know, Dr. Paul Bean, he is an ER doc, and we tell us a little bit about how your group works and where you are right now.
Yeah, I spend the majority of my clinical time at Grant Medical Center, the large trauma center downtown, as I'm sure most of the viewers know. But we also work at several other Ohio Health hospitals, including the small freestanding emergency department down the street there on Hamilton Quarter, New Albany freestanding emergency department, Riverside Methodist, and Dublin Methodist. So it's fun. I spend the majority of my time at Grant Medical Center, and it's been different. It's been busy. Not always like the news is portraying. Not all emergency departments are busting at the seams. That being said, it's really, really, really busy. And, some things are down. There's been less trauma, and I equate that to a couple things. One, it's been cold out, so people are doing less stupid things, right? Not riding ATVs, etc. And people aren't driving to work. They're at home, so there's less motor vehicle crashes. That I'm sure everyone has noticed. That the 670, 270, 161, et cetera, far less traffic. Even at 7 a.m., like 161 used to get backed up, and it does not anymore, not
Yeah.
like it used to. Additionally, you can kind of extrapolate from that and say, well, people aren't going into the office, and that's where communicable disease happens, right? They're staying at home. So there are less sick people. The converse of that is, well, can't get to my doctor, don't want to go to my doctor won't see me, my primary care physician or specialist. So I'm sitting at home and I'm getting a little bit sicker, and that foot wound turns into a really large ulcer, and I'm a diabetic and I'm getting sicker. And then 6-8 weeks later, it's not getting better. I come to the ER and I'm really, really, really sick. So we're seeing, a lot of that too. In terms of COVID, we are seeing a ton of COVID. COVID is everywhere. It's everywhere you turn and look. We're testing all admitted patients. And the reason for that is so that, we try to keep COVID positive patients together so as to spread it less, right? It's intuitive. And so, you test patients that are there for a broken hip, asymptomatic. They're not there for any COVID or COVID related complaints, and they're positive. So that should tell you that it's pretty penetrated. It's pretty widespread.
Is it basically anybody who walks through the door gets a COVID test?
No, but any patient who's not going home, any patient who's admitted is getting.
God. Okay. I see what you're saying. Okay.
I feel safe, and I'll talk about that for a couple of minutes. I think the
Sure.
audience would enjoy that. I have tested my antibodies twice, fairly reliable, and I've been negative. I was negative in April, and I was negative last month. That leads me to believe I'm really, really, really safe at work and outside of work, but specifically at work.
Is that what do you attribute that to? The processes or the PPE?
Yeah, I have, like abundance of PPE and being extraordinarily careful. I have the luxury of being like, all right, this patient has a cough really quick. I'm going to put on full PPE. I literally look like I'm in a hazmat suit, right?
Mm.
And I'm safe. You know what I mean?
Yeah.
And
Yeah.
we have the luxury of saying to the patient, hey, Mrs. Jones, why don't you pull your mask on up over your face? So I have the luxury of protecting myself, as I enter into a patient's room. And if I have even the slightest index of suspicion that the patient could be, COVID positive, I'm, fully hazmating up. That being said, we're somewhat at the point where, man, it's everywhere, and I see myself putting on, full PPE more than I ever have been since the beginning of the pandemic.
Is that like a daily? I mean, daily more than daily thing for you?
Oh, hourly, Benji.
Hourly, interesting. Is it? Can you move around and that stuff? It looks so
Yeah,
cumbersome.
it's a couple things. One, and like it's just sweaty. It's like
Yeah.
it's not breathable. It's
Right. I
not.
guess that's probably good.
Yeah, it's not designer high end.
Right.
There are no vented areas.
It's fair.
And the mask is just like so irritating to your face. There's a new term that I did not coin called maskne instead of acne. It's maskne.
Yeah.
Your face is just getting so irritating. And like when I come home, I have two very large marks here from the N95 pushing against my like upper cheekbones.
Yeah.
It's the price we pay on. It's not the end of the world, but it's cumbersome, but it's almost analogous to like a helmet. Remember when we were like kids riding around our bikes in the neighborhood? You weren't the cool kid if your parents made you wear the helmet,
Yeah.
right?
Absolutely. Yeah.
You looked dorky, but it kept you safe, right? And so masks are. I think the analogy is similar to masks.
I got to tell you, we had an outdoor service last Friday night, and I was wearing my cloth mask. And man, that thing keeps you nice and toasty outside.
Yeah.
It's a fringe benefit nobody talks about.
Yeah.
But let me tell you, cloth mask, great for the winter.
I'll tell you, like some silver linings of coffee. I really need to arm myself post-pandemic with breath mints, because you don't realize how bad your Tim Hortons or Starbucks or coffee breath is.
Yeah.
You're wearing a mask, it like bounces right back in your face. So post-pandemic, I'm going to be very much cognizant of my coffee break.
So I'm gonna say, like, Paul, what did you learn, about yourself during COVID?
Horrific.
It's just the breath.
Halitosis. Yeah.
That's hysterical. So you said that you're feeling pretty safe. Are the numbers that you're seeing in the hospital at the moment, does it feel like they're going up? Does it feel like the trend is like plateaued?
Up for sure.
Oh,
Anecdotally speaking, at Grant Medical Center. So up for sure. Everyone's talking about the vaccine, and I feel like we should spend some time on that.
Definitely.
And it is the light at the end of the tunnel, Benji, I think, but it's a really long tunnel, and we have a lot of people to vaccinate, right?
Can we talk a little bit about that? Let's talk.
Asked?
What?
I thought you'd never ask.
Go on. Oh, vaccines. So tell us, first of all, I'd love to know your feeling on the quickness that in which the vaccines, at least the Pfizer vaccine, was approved. Do you feel like it's safe and all that kind of good stuff?
Yeah, 1,000%. So I think the truest testament to that is disclosing how many people are we at now? 14?
16.
Whoa. Wow. Prime time. So
Prime time.
To the 16 viewers, 2 of which are my folks, I suspect.
But probably only on one device.
Well said. So I'm getting my vaccine tomorrow morning at 10 a.m. Super excited.
Wow.
Pfizer vaccine. And then I'll get the subsequent dose 21 days later. I think it's very safe. I think it did go fast, but we needed it to get fast. We needed it to be fast. There's a lot of great science behind it. The study is excellent. Like nearly 40,000 participants. It was not studied in kids, so that's one caveat. Like 16 years and older. Multinational global study, really well done. There's a phenomenal article that goes over the study in the New England Journal of Medicine that it's free and widely available. That was published on December 10th. So yeah, tomorrow 10 a.m. going to get stuck in the arm. I don't know. A couple people I've talked to who have had it yesterday or today said their arm was like a little bit sore, and that's about it so far. So most people have started getting it. I guess it got to Ohio. It left the Pfizer factory in Kalamazoo, Michigan, Sunday midday, got to Ohio Monday morning. The governor was at OSU, receiving it, and you saw the UPS truck, and it was kind of cool.
That's cool.
It needs to be kept rather cold, like -90 degrees. So a ton of logistics behind the scene about freezer space. So
Yeah.
the local health systems have done a really good job.
I from what I understand, Graders has been helping out, and Jenny's as well.
Yes.
And
you might get very thawed ice cream, but it's because they're storing vaccines.
That's right.
Adjacent to their chocolate chip mix.
Or raspberry chocolate chip COVID vaccine.
Sprinkled with some mRNA, right?
Why not?
What could be better?
What could be better? So you're getting the vaccine tomorrow morning. That is very exciting.
I'm really excited about it. I have absolutely no reservations. I think the risks are subtle to none, and the benefits are extraordinary.
Amazing.
So I'm really excited. Not nervous at all. Maybe it'll hurt a little bit, but so does a flu shot. I mean, it's a needle in your deltoid. I do not have very large deltoid muscles, so.
Fair. All right. Do you have a vaccine outfit picked out for tomorrow?
Yeah. Hold on. Hey, fellas, will you go grab the dog, please? I have probably something with easily accessible sleeves. Tank top. Yeah,
tank top is great for work.
Right? In December.
In December, yeah. Hey, if anyone out there, by the way, I see that we have more and more people watching. If anybody has a question for the doctor, go ahead and stick it in the comments here, and we will do our best to get to them. Hold on one second. No, okay. Oh, sorry. I see that there are a bunch of comments that my phone's being weird. All right, let's see. We got just some hellos. Leah Miller wants to know, is there going to be a vaccine for kids? And kind of related to that, Erica Rozanchik said, would you give your kids a vaccine?
Yeah, so I wouldn't tomorrow because it wasn't studied in kids. And I think the transmission in kids is different. And the kids are certainly less sick than the adults. So I think probably focus on the adult population who tend to get sicker. And once it's studied in kids, and as long as it has similar safety profile, I absolutely would. But it wasn't studied in under 16-year-olds, so I would not feel safe giving this vaccine to my kids. But that's certainly not the point right now. But yes, eventually, once it's well studied, I would plan to.
There's another doctor who I happen to be married to who told me that that there is a study happening right now of a Pfizer study in the Dublin area. For kids with the Pfizer vaccine. 12 and up is what Lauren is saying from upstairs. So kids 12 and up. Interesting. So we'll see what happens. So I don't know how it works with the other vaccines, but is it, you think, for COVID that sometime later they'll roll out the kids version of it, or it'll just be approved for kids?
No, I think they're going to have to study it and think about doses and think about repeat. But yes, I think it'll be similar in that regard.
Got it. Interesting. All right. Oh, we got some nice hellos, and hey, Marilyn Altman, that's a nice Jewish heart thing we got going on there. I think that's for you. It's a couple of hearts and a Jewish star.
Hey, Marilyn.
So you're getting the vaccine tomorrow, and you're do you know much about the different vaccines that are out there? I mean,
get the dog, please. Sorry.
No, it's right. I mean, so we know that the Pfizer vaccine has been approved. There's also the Moderna and another vaccine. Do you know, like, are there differences when they're all available? Do we say like, oh, I'd like a Pfizer vaccine, or I'd like
that's a hard question to answer. There are some distinct differences between the Pfizer and the Moderna one. I suspect the Moderna one will be FDA approved by end of the week, if not first week tomorrow. the spacing in between doses is a little bit different. The storage is different. And there's some like subtle nuances at the cellular level, but not all that different. And I suspect they'll have similar, if not equal, safety profiles and efficacy. There's a British one, and I believe it's AstraZeneca. The dose is maybe halved on the second one. Sorry, Hey fellas, I really need you to get the dog.
Oh no, is the dog okay?
Unattended for. You got to stay by him, Eyes. Thank you. The dog is okay.
Okay.
So yeah, I don't think that there'll be much differences, and it's going to turn out to be a supply and demand thing, right? Like anything.
Yeah, yeah, yeah. I wonder if down the road, they say that maybe 6 months from now, there will be enough vaccine for anyone who wants it. I wonder if that'll actually be the case, or if more folks will want it, then will be available, or if there are folks who don't want it and don't feel safe about it, and yeah, I don't know.
Yeah, I think people are still waiting to see what happens, waiting to hear. It should speak volumes that I'm going to get mine tomorrow. I would have gotten it yesterday if there were spots available. I'm excited about it. So the study was designed for safety as the endpoint, and it certainly is very, very, very safe. And the adverse effects were kind of like in any study, from minor to major, and there really were no deaths attributed to the actual vaccine. So
which I'm assuming is major.
Yeah, and there really weren't any neurologic. Right, death would be major. And there really were no major neurologic outcomes. There's some reported neurologic outcomes with the flu vaccine annually. That is oftentimes a big scare, and there wasn't any of this. There wasn't a ton of allergic reaction or anaphylaxis. There were some body aches, some fevers, obviously localized pain at the site of injection, numbness and tingling around the site of injection. Those are all tolerable, self-limiting, meaning that they're going to get better in a short period of time.
For sure, yeah.
I have zero reservations about short-term or long-term effects.
That's great. Well, that is exciting. I wonder if you are the first person in our Temple community. I guess I haven't talked to all the docs
Maybe.
who are in the hospitals. And does it work? Is it so? Do the hospitals themselves distribute it to staff, or is it through your group, or is it through OSU? How does it work?
So it's through Ohio Health. So the state, it's managed at the state level. The state got X amount distributed at first time around, distributed to hospitals designated based on region, demand, et cetera. And then there's this tier of 1A, which is like frontline workers, anesthesiologists, obstetricians, emergency room physicians, nurses, respiratory therapists, all over the patient, sometimes longer than I am. EVS, environmental services, people in the hospital who are cleaning COVID rooms, they're certainly at very high risk. And then it's really actually on the state website, it's really well laid out who is in that first tier, et cetera. So, and then within that first tier, they decided that emergency staff, nurses, docs, anesthesiologists, OR staff, frontline workers, the list goes on and on, would be the first people to get that. So
do you think, is there any chance that when you're there tomorrow, you could just grab a handful of vaccines and we could have a Temple fundraiser and see if we could just, get some people vaccinated, make a couple $1 million for the Temple?
Highest bidder. Yeah, probably not.
Unlikely.
It would make for a really good Dateline NBC story, though.
It would be great. Keith Morrison would be very happy to have that as a.
I don't know who would play a role. I suspect Brad Pitt.
Yeah, I could see that. I could definitely see that. Yeah,
Clooney was probably booked.
Yeah, he's busy. He's a busy man. Can I ask you about a non-COVID question? But do you think that because of the things you talked about earlier, where fewer people are working in offices, there are few people that are out, people are wearing masks. Is there a chance that I know that everyone was really worried about the flu and COVID coming on at the same time? Is there a chance that may not happen, or does it
That's
seem like
a
a
great question, and I think we're right on the verge of knowing that. I have seen personally some influenza A and B positive patients.
interesting?
So sometimes the symptoms are clinically indistinguishable until you have a test. So that's been very helpful. Sometimes it's the southern hemisphere gets influenza first, and they had less of a virulent influenza season thus far. So that tends to be a predictor. People are wearing masks. People aren't at the office, at the water cooler, at Temple, at sporting events, at the gym. I'm hoping that theory is proven to be true and it is less, because then super sick influenza patients will also need ICU and vents on top of COVID patients. So
Got it. So the healthier we can keep everybody, the safer it's gonna be for everyone.
yes, sir.
Yeah, that's interesting. Well, hopefully, yeah, that'll be a side benefit to the
There are a
the
couple
stay at
silver
home
linings.
advisor.
Yes. Yeah. More
Uh,
family time.
yeah. Oh, there are again. I'm sorry, my phone got frozen up here, but there are a bunch of questions.
Let's do it.
Um, let me start with the last one first, and I'll work my way back. Miriam Siegfried says, "Do you think distribution of the vaccine in rural areas will be a problem due to the super cold storage requirements?"
Yes, absolutely. It's interesting. There's all of a sudden this like demand for and need for cryo freezing capabilities. And yes, I think the farther you get out of big cities where there are warehouses or freezer capability, I think it's going to be hard to distribute outside of large municipalities and metropolises. Absolutely.
I guess that's something that they're working on at the moment. I'm
Yeah, I don't have a
assuming.
great solution for that.
Yeah,
I
that's
can't
great.
recall what the storage requirements for the Moderna vaccine are.
Yeah.
It might
Oh,
be.
I wonder, is that an option you think to have a certain vaccine more available in rural areas because it can be stored differently?
I would imagine.
Yeah, that's interesting.
It's a great question.
Um, so a couple of them here. Kathy asks, do pre-existing conditions matter when you get the vaccine?
They should not.
Okay. Okay.
Good question.
Yeah. Yeah. And Sue says that her daughter works at an assisted living facility, and she says she wonders when she'll get the vaccine.
Pretty sure nursing homes, etc., are on that some part of that 1A that the governor has discussed.
In this first round.
Yes.
Interesting. Okay. And then Meredith says, what about people with allergies for the vaccine?
Yeah, great question. Something you would have to talk to your family doctor about specifically, or whoever might be administering the vaccine. But there were some patients who had local or brief allergic symptoms with a history of some type of other allergy, and so that would be something you'd want to discuss, with your family doctor or an allergist if you see one.
I've got like a question that I don't mean this to be like a daunting question, but so we, we're in this. Oh, sorry.
No, it's okay. He's by the door. You got to go get him, sir. Thank you. Sorry.
That's a cute dog. What's the dog's name?
Oscar.
Oh yeah, that's right, Oscar.
That's his Hebrew name too.
Oh, good to know.
It's easy.
It's Oscar. Wait, I forgot. I forgot what I was going to ask. But
a daunting question.
Oh right, yeah. We've made it through COVID-19 so far. We're in the middle of this pandemic. Seems like we have found, the vaccines are on the horizon. How likely is something like this, to happen? We've talked about the horrible 2020. How likely is it that, God forbid, 6 months into the next year, a similar thing would occur? I mean, is that unlikely?
I don't know. I guess I can answer your question I don't think we're going to be out of this in like the first quarter or second quarter of 2021. I think it's going to be really hard to get everyone vaccinated. I think people are going to continue to make less wise decisions. Is this going to be like an influenza every year where we're going to have to get vaccinated? I don't think anyone knows the answer to that definitively. It's a great question, and I think the answer is unknown.
Yeah. Or if we'll have to get like a COVID booster or something like that.
Something of the like, because, so the study was a very short period of time. And I'm just looking at it right now. Anyways, it was over although it was a large number of enrollees, it was over a short period of time. The question is going to be, how long does immunity last, or conferred immunity? So, and we can't fast forward to the future. You know what I mean?
Yeah. Yeah. Hopefully a good long time.
It's exciting that 2 doses of the Pfizer vaccine gives you like 95% conferred protection against COVID-19 in persons 16 and older.
That's crazy. So then the theory is, if enough people get it, then the thing is just gone, and transmission is.
Hope so.
Yeah, that's great. Okay, let's see, what else do we have here. Hold on. Sorry if I missed some questions.
Isaac, can you watch him, buddy? Can you guys take him outside? He definitely has to use the bathroom. Please, guys, he's asking me to go out to the bathroom.
Oscar needs to go.
Sorry, everyone.
Oscar needs to go, everyone. Ryan and Isaac, do it for the Jewish community. Take one for
Benji,
the Jews.
I lost you.
Oh, can you see me? You can't hear me?
You're on mute, maybe?
Can you see me? Hear me? Hello? Hello, Paul. Oh.
Gotcha.
Is this the end? Are we back?
No, we're here.
Okay, great.
Sorry.
Oh, yeah. Okay, good. All right, well, we're back for with Paul being here. Oscar has hopefully gone out to the bathroom now. And
Fellas, thank you.
Yes.
Sorry.
That's the reason you have kids, is sometimes they just don't know that.
Right.
And they don't always do it. That's all the questions that we've got here. Can I just ask you, like, on a personal level? I mean, how are you feeling about? Are you feeling hopeful? Are you feeling nervous? I know you're okay with the vaccine, but are you, looking at what you see every day? You say that it's getting worse and worse, but does that vaccine make you hopeful? Do you think people are going to get it?
I finally feel great about this vaccine. It's like finally something we needed. Boys, you have to take the dog out, please. It's finally something we needed. And yes, I'm hopeful, but I don't think like we're done February 1st. I think we have a long way to go.
Yeah. Yeah. Somebody asked me today, actually, so when are we going to start holding services back in the sanctuary? And I am the first, I would love to have that room packed full. It's very depressing to have like 10 seats in there right now. But I said I can't imagine before late spring, early summer that we would be doing anything, and God willing, it's even then.
Yes, I think summer would be a realistic goal. Fellas, please go get the dog. They're not taking him outside.
They're not. Poor Oscar.
I know, but just go get him, please. It's snowing, I'm told.
That's fair. It's cold out there. Nobody wants to go outside except for Oscar.
Yeah, I'm sorry, Facebook audience.
The Facebook audience is enjoying this. Yeah. We have hectic households here. Well, all right. I don't see any other questions here, but I'm wondering if maybe we can get you back here, maybe post vaccine to kind of I'll
try to get a picture tomorrow, and I can send it to you, and you can distribute. I'm really excited about it. I'm honored to be among one of the first Ohioans to get vaccinated, in these first 72 hours since it's been in state. And I have absolutely, I might need an arm massage tomorrow, Rabbi.
Come over to the temple.
Okay.
And we'll get Nick Serrani. Nick, where are you? If you're watching, Nick, Paul's your man tomorrow.
Okay.
Nick does, Nick has
Sure.
sound touch massage.
Yes.
Well, everyone, I am very grateful to Dr. Paul Bean, and I'm sure that you are as well.
I guess I would just use this platform in closing to say, like, don't let your guard down. We're talking about this like COVID fatigue. We're all tired. I'm really tired. It's so hard to wear a mask. It is so hard to, not go to the store and not be able to do your normal travel plans or not be able to do sports. But we just have to hang in there a little bit more.
Yeah, it is.
Hey boys,
it's a
go
challenge.
get the dog, please, upstairs. This is a disaster. Sorry, Benji. Now, guys. Sorry, very embarrassing.
This is not a disaster. This is very entertaining.
Now, fellas.
I can't wait to see what happens in your house after this. It'll be like
to be an accident somewhere.
there's going to be pee everywhere. Yeah, hopefully people don't succumb to the fatigue and they stay strong. I would love to go to a restaurant, but we're gonna hold on.
Businesses, DoorDash is a beautiful thing.
Yeah,
and just hang in there for another, 5, 6, 7 months, and like don't. Selfishly, it protects me. Like, the less COVID patients I see, the better. And like, I just hope people can keep it up. There definitely is this concept of like COVID exhaustion or fatigue or whatever you might want to call it. And it's hard in the winter too, right? But in summer, at least you can be outside and enjoy some people from a safe space. It's much harder to do in this weather. So I just would encourage people to kind of, please keep it up a little bit more. Close.
We can do it.
Beginning of the end of the tunnel.
I think as long as there's one magical word, and it's alcohol. As long as you have enough alcohol,
right?
Homeschool, we can handle it.
Bourbon makes homeschooling a little bit easier.
Bourbon works.
Yes.
I got some from Rabbi Len. I got me some Glenlivet for my birthday.
Well, that was nice.
Very nice, and that's gonna help with the homeschool.
It's gonna help with a lot of things.
Yes, it sure will. Well, everyone, let's. We got one last question here, and then we're gonna wrap up. Erica Rosanchik asks, "Are there enough tests in Ohio? It seems hard to get a test."
Yeah, it's a supply chain issue. Sometimes it's the reagent. It fluctuates literally by the day. I would say there probably are not a ton of surplus of tests. I haven't seen. We had a shortage like 2 weeks ago, and then we got some supply back. I would say it's touch and go, and there probably is not a surplus of tests. It's a great question, Erica.
Yeah. You think we need to get there. We need to get supply on those tests.
The FDA approved an at-home kit that like yesterday, which is cool, but I don't know that it's in the marketplace just yet.
And I read that it was gonna be probably pretty expensive also.
Super cost prohibitive.
Yep. But Hanukkah, one more day.
Maybe side business in your driveway.
Side business. Yes. Yeah. If the you stealing vaccine doesn't work, then
how about swab and simchas?
Swab and simcha. I like that.
Yeah.
There are congregations who are that have testing sites. The congregation where we got married in Detroit does testing on site. Right. Certainly, the temple is available if anyone wanted to set up there.
Right over there on Orchard Lake Road and Walnut.
I think you're right.
Yes.
Yeah, it's interesting. So we'll see. So we need some tests.
Yes.
I feel fortunate that through my physician, my real physician, not Lauren, I was able to get a test when I had a sore throat a couple weeks ago, and
good.
It was a rapid test. It was easy. The test, everyone was saying, "Oh, the test is going to be so horrible." It was not terrible at all. It was all of literally 3 seconds.
I felt like you had a sneeze, right?
Yeah, I mean it's not comfortable, but it's so fast, and it doesn't hurt. Right. That's for sure.
Right.
Anyway, all right, everyone. When the vaccine becomes available, be like Dr. Paul Bean and get your vaccine.
Big day tomorrow. I better get some rest.
Big day tomorrow. Yeah, you got to rest that arm.
I'm not going to sleep on my left arm.
Go put all of your tank tops in the wash. Get them ready for tomorrow.
And all of it.
Yeah, that'd be great. All right, everyone. Big thank you to Dr. Paul Bean. Thank you for friends who have joined us tonight, and hopefully we'll be able to post a picture of Paul getting the
I'll text
vaccine.
you tomorrow.
That'd be great. All right, everyone. Have a great night. I'm gonna